Hi, my name is Anissa, and I did my journal review on benign paroxysmal positional vertigo, also known as BPPV, and it was a case report. What is BPPV? BPPV is an inner ear problem that causes short periods of dizziness when your head is moving in certain positions. The most common positive BPPV positions are lying down, turning over in bed, or looking up, like looking at the ceiling, looking at the sky, or changing a light bulb, things of those sorts. Dizziness, which is also known as vertigo, lasts for a few seconds to a minute and can feel like the room is spinning. What causes BPPV? BPPV can occur when free-floating otoconia move to one of the three semicircular canals in the inner ear, and they either get trapped, which is known as canalithesius, or they adhere to the cupola of the semicircular canal, which is known as cupoleolithiasis. Patients with BPPV usually experience rotary nystagmus, so that's kind of where your eye is beating, kind of moving back and forth without your control. The posterior canal BPPV canalithesius is actually the most common, and to diagnose BPPV, the Dix-Hallpike test is used. And although symptoms only last up to 60 seconds at a time, 80% of patients experience rotary nystagmus and 40% complain of a floating sensation with such activities like rolling around in bed, kind of, again, looking up at the ceiling, or even doing trunk flexion. And since there are several different kinds of BPPV, but posterior canal being the most common, that actually occurs in roughly 85 to 95% of cases. And that usually occurs simply because that's the most gravity dependent position when a person is either standing or lying on their back. So in order for the otoconia to actually exit the canal spontaneously, it kind of moves opposite of the gravitational pull. The last 5 to 15% is actually caused by lateral or horizontal canal BPPV. So my case report, I have here the purpose and the patient history. The purpose I didn't actually think was a strong one, but this was what was stated in the report, and it was to illustrate the use of the World Health Organization's International Classification of Functioning, Disability, and Health, which is known as the ICF model, and the evidence-based management of posterior canal benign paroxysmal positional vertigo. So the patient that they had, which the sample size was only actually one person, and it was a 74-year-old female, and she presented with dizziness for 2 months. Her symptoms began first when she was actually watching her granddaughter play a video game, and they got worse when she was getting in and out of bed, and when she was also changing her light bulb. And what she would do to actually kind of calm those symptoms down is she would just lay flat or just kind of avoid moving her head either from side to side or up and down altogether. So the procedure that they actually did with her is when she came in for the first visit, the patient received the Dizziness Handicap Inventory, which is DHI, and it's a 25-item scale ranging from 0 to 100, but the minimum for clinical importance is 11 out of 100, and the patient actually only scored a 14 out of 100, so it is not extremely high, but it was still clinically relevant for them to be able to use her as a person in this study. The patient also was screened for gaze instability, which included smooth pursuit. So what that ultimately is that the patient has their head facing straight forward, and the therapist will put their finger or a pencil, something of that sort, just in front of them, and they'll move the pencil from side to side or up and down or even diagonally, and the patient actually has to follow that object with their eyes. And what the therapist is actually looking for is what's called a saccade. So your eye is kind of trying to make a corrective movement, so your eye actually doesn't get all the way to the pencil, so it'll stop halfway and you quickly try to correct it to get the full length. And they also did a vestibulo-ocular reflex with her. So as you can see by the picture that I have here on the right, the person's head is facing straight forward. Again, there's a pencil or a finger, something that is right in front of the patient, and the patient has to actually turn their head from side to side and keeping their eyes on that object. And that usually either they're looking for saccades there as well, but they're also looking if the symptoms actually worsen or intensify with those movements. This patient also received the Epley maneuver, and she had 3 maneuvers that were performed over a 4-week time span, and after the 4 weeks, she actually was negative for the Dix-Hallpike, which is also in the outcomes that I'm going to go to next. So the outcomes. If you can see here on the right, I have a kind of a picture of the Epley maneuver. So what they do is they turn the patient's head 45 degrees to the affected ear, and then they drop them back down really quickly. The symptoms start to intensify, and the person actually stays in that position until the symptoms go away. They're told to keep their eyes open so that, one, the therapist knows if nystagmus is still going on, as well as the patient's able to kind of feel the symptoms go from worse to better. As soon as the symptoms decrease, they turn their head 90 degrees to the opposite side. They sit there for about 20 to 30 seconds to hopefully kind of get those otoconia to actually start shifting in that ear canal. And then they turn them side-lying, and again, they sit with their head facing the unaffected shoulder at this side. And then from there, they sit up with their head pointed down to the unaffected shoulder. And that's just overall what the Epley maneuver is. So after 4 weeks, which included the 3 Epley maneuvers, the patient actually had a negative Dix-Hallpike testing, and her score for her DHI reduced to 0 out of 100. And she resumed normal activities of daily living with no BPPV symptoms at all, and she was able to kind of continue to keep playing with her granddaughter, who she was the primary caretaker of. So overall, do I think this was a good or a bad study? And I think the emoji on the right kind of shows you that I think that this study was not a great study. I don't think that the study had anything that was quantifiable, so there was really nothing that they could use to base their study off of. And this study can't be recreated by any other clinician because the sample size was way too small. And they actually didn't give a true step-by-step process of what they did with the patient. All we know is that they did the Epley maneuver, but other than that, we don't know if they did any other exercises with her, because that wasn't stated in the article either. What I would change is that I would focus the study on the Dix-Hallpike and the Epley maneuver to make sure that you have something that you can statistically quantify while moving forward. And also, since the sample size was so small, I would increase the sample size to have hopefully a greater number sample size. I can't really give a ballpark number, but hopefully somewhere in the 100 range, so that it could be something that could actually give a good statistic back. And then from there, I would try to see, have a control group, have a treatment group, and then see how many Epley maneuvers it took for patients' symptoms, their Dix-Hallpike to actually become negative, or how long as well, so how many months they were actually in treatment. And I would also give them exercises that they could do so that from clinician to clinician, we would be able to actually recreate this study and do it over and over again, and hopefully get the same results every time that it's done. Those are the things that I would change. Overall, do I think them talking about the ICF was great? Yes, because I do think people that should utilize it. But do I think that that should have been the purpose of their study? No, because I don't think that it really gave us anything to base the information off of. So, kind of hit and miss. And lastly, these are my references. The second reference is actually the article or the case report that was actually used. The first one is actually just what is a BPPV article, and it was from neuropt.org. Thank you so much.